Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist with the Division of Public Health and Community Services. And welcome to our show today. Before we get started, I'd like to give you a little bit of a COVID update. It'll be short, so stay tuned for our special guest. We want to look first at our map of community levels. Right now, as you see from this map, New Hampshire is almost fully yellow. We were green for several weeks in a row, which was low transmission, and rates of COVID-19 have increased in the last several weeks. And so we want to give people a little bit of warning that as these rates are going up, and if you are immunocompromised or at medical risk for a worse outcome from a virus, please make sure you're wearing your mask inside and outside. You can see here the low, medium, and high income levels, COVID levels. So our best defense, our best protection against COVID-19 is to get fully vaccinated, protect yourself and those you love. It's not too late to vaccinate. We want to let you can start your series today. You can complete your series today. So there's lots of, if you go into vaccines.gov, you can find some places that have appointments. Most of the retail pharmacies, Hannaford, all those different places, Walmart, they all have the COVID-19 vaccine. So please don't put it off any longer. We want to be done with this thing once and for all. Just a quick review of what those booster shots mean. So why do we do booster shots? It's the protection you get from a vaccine. Wears off after a little bit of time. So an additional dose of vaccine may be needed to boost your immune response and make sure you're protected. So please, those of you who have not gotten your booster yet, go out and get that. People don't often realize that boosters are really common for many vaccines like tetanus and diphtheria and pertussis. So we all get boosters for a regular vaccine series without even realizing it. The best way to protect yourself from COVID-19, including Omicron, again, is to get vaccinated and boosted. And everyone 12 years of age and older should get a booster. And that's at least 5 months after your first original series and 2 months if you've had Johnson & Johnson. Again, 12 and older should get a booster shot. And then there's a question about mixing and matching. Mixing and matching is getting a different COVID-19 booster than your initial vaccine. So a Johnson & Johnson recipient should get boosted with Pfizer or Moderna. And it is recommended that Pfizer and Moderna recipients get the same booster as their initial shot, but may mix and match depending on your preference and availability. So for those first 2 shots, you want to stay with the same series. When you get your booster shot, you can mix and match. And right now we have adults 50 and older, and some immunocompromised individuals are now eligible for a second booster shot at least 4 months after your after your first booster. So lots of things going on. In the news, airplanes a lot of airlines are no longer going to require masks on board, but think about your risk when you're going on a flight. Just a little slide here shows the CO2 levels and in the air. So when you're boarding the flight, it's going to be pretty crowded in those tunnels. And when you're taxiing for a flight before that filtration system gets on in the plane, you're also at higher risk. So think about wearing those masks still when you're traveling. I know I'm going to wear mine going away next week, looking forward to it. So without any further ado, that's our COVID update. We're going to keep it short and sweet. I'd like to welcome Kristin Makara from the Doorway. Welcome, Kristin.
Hi, thank you, Jane.
We're going to talk today mostly about, it's Alcohol Awareness Month, and a lot of alcohol misuse has taken place during the pandemic, even prior to the pandemic. It's an issue that sometimes gets lost with all the other things going on. So we want to bring it to the forefront because it is Alcohol Awareness Month. But first, before we do that, I want to talk about you and what you do and the agency that you work for, which is the Doorway. But let's talk about you first and what you do at the Doorway.
Okay. Well, thank you for having me.
Sure.
So I am 50% administrative, 50% clinical. So what that means is I do all of the clinical work. I'm the only clinician there currently, but also the administrative piece. So that is kind of managing the grant. So our program is funded by the state opioid response grant through SAMHSA, originally for the federal government and then to the state government.
Okay, so as the director, so tell me a little bit about the Doorway, because some people have probably seen it. It's right on Main Street. Am I correct?
268 Main Street.
Okay, 268 Main Street,
Yep.
because you can walk in for referrals. So just tell me a little bit about the Doorway so that our viewers understand what this service is.
Sure. So it's set up to help individuals get into substance use treatment, preferably same day, but as soon as possible. It is funded for opiate and stimulant use disorder primarily, but we will assist anybody with a substance use disorder. We do a full clinical evaluation, assessment to determine what their best level of care is.
Okay.
Then we facilitate or help the referral to get to whatever level of care that is, whether it's an inpatient treatment, outpatient, what have you. Do you want me to give you all of the things that we do, or stop there for the moment?
You can keep going.
Okay, so we also are responsible for Narcan distribution to Nashua and the surrounding communities, which are in our catchment area. So we distribute to community partners, to individuals. We also go out and do daily outreach to try to connect with folks who are actively using in the community, to try to disperse to them. So Narcan reverses opioid overdose.
And I'm familiar with that only because at the health department we do go out with you guys, I believe.
Yes, on Mondays we work together there.
And I did do a ride along, and it's very interesting. So what's the benefit of letting people have Narcan? We call it harm reduction.
Yep.
But why do we want to do that?
So we do that because the risk of opiate overdose is so high. What is in opiates now is mostly fentanyl, sometimes even more powerful substances that people aren't even aware of that are in there. So if they overdose, if they have it with them, someone can learn how to use it and reverse that overdose to save a life.
So the Doorway is a state-sponsored, state-funded
program.
And I noticed, I went online because I had to do a little research, right? That it's all over the state. So there is a Doorway in Nashua, but there's also one in Manchester, and there's one in pretty much trying to capture every region in the state so that there's access to these kind of services.
Yeah, I believe it was set up, so there's 9. I believe it was set up so that there was one within an hour driving distance of pretty much everywhere in New Hampshire.
Okay, which is really great, especially for our friends way up north. I do notice there is one in Berlin.
There is.
So that would help our friends way up north.
Yep.
But there are several, and of course we're talking about Nashua's Doorway today, but it is good for people to know that may have relatives in the state that may require services, that this is a great referral source for anywhere in the state that might be closer to somebody that they're dealing with. And you did talk about overdose reduction, so that was the Narcan. There are lots of services, recovery support. So what goes on with that? So
with the recovery support, we are staffed with 3 full-time CRSWs, so they're peer recovery support workers. So they're individuals who are in recovery themselves, so they have lived experience. That experience really can help them connect and understand, and often make somebody else feel more comfortable because of the stigma that's associated, people feeling judged because of previous experiences.
Yeah, so that's great. And actually, I think I met some of those folks when I was out on the van, with our van.
Fantastic.
They were great. And so find treatment, you mentioned that, and you said different levels of treatment, because some people might require outpatient treatment, medical assisted, I'm going to say it wrong, MAT, I know what it means, but maybe you could explain that.
Yeah, so medically assisted treatment. I think medically assisted used to be something similar, but basically, so it's often it's opiate replacement therapy for opiates, but there's also anti-craving medications for alcohol. So Suboxone, methadone, and then Antabuse, Campril, There's lots of different medications to assist.
So you're figuring out, though, do they need that? Do they need to go into an inpatient program? Like, how do you do that assessment and figure out the different places?
There's a couple of different, evidence-based assessments that help determine what is the best level, what's the best support for them based on their individual experience. So everything's really individualized.
Great. And prevention is, you have prevention services or prevention counseling, or?
So we do bridge therapy there for folks who are trying to get connected with outpatient and maybe there's a wait. So that's part of it. Prevention, I think, also kind of refers to some of that harm reduction, the peer support. They get some individual kind of counseling on how to best navigate maybe if their current environment.
So you'll have that peer support, but do you run any groups out of the Doorway?
So we don't do any groups in the Doorway. Part of that is the size and the areas that we would have to run a group, and in part because of COVID. We opened in the peak of it in May of 2020. But we do groups at Revive Recovery Center in one of their rooms.
Okay, so it's, again, working together as a community and putting that together, putting the agencies together, and everyone can't do everything.
Absolutely not.
So we do need to work together, that's for sure. Help is a call away. We have a slide we'll put up. You can call 211. They can hopefully refer you to the Doorway or to the Doorway closest to you.
Yes, you can call our number directly at 603-402-2056. So you can call that number as well. If you call, we're affiliated with Southern New Hampshire Health, so if you call them, they can refer you over. But certainly walking in, we're open 8 to 5, Monday through Friday.
Okay. Which is really an amazing thing. So you can just walk, there aren't many providers or referral service where you can just walk in and get some help. So that is, and it's very accessible, it's downtown. I think that's just an amazing thing. On a given day, do you have a lot of people walking in for services or for referrals?
It's so hard to come up with an average, really. Yeah. But I would say the majority of our people, our clients do walk in. Whether they're already connected to us, they come in for additional support or case management services, help with an application, a referral to maybe, a food pantry, shelter, recovery housing, anything like that. So they may refer to get services, but then they may come back because they can do some case management with you. Correct. Okay, so it's not just a one-time thing. It is absolutely not. It is part of our grant, but also it's just good practice. We follow people for up to a year.
Okay.
So we're calling them every week, every other week, once a month, kind of depending on where they're at, to see how they're doing, see if they need anything.
So it's like more of a warm handoff. Like they might be getting more services, but you're going to make sure that they're getting there, maybe that they're even getting to the services, because that can be an issue as well.
Correct. And I think another thing too to keep in mind, the primary symptom of a substance use disorder is relapse. So, continuing to check in for someone who has relapsed, they may not necessarily call us, but if we're calling them, we may reach somebody who wasn't quite ready, but then become ready.
Yeah. Does it takes a lot though to recover from substance misuse. It may not happen the first time you try.
Correct.
Is there an average or amount of time or how many tries it takes, or?
Everybody's so individual. There's so many factors.
Yeah.
But you're right. It's often not. I don't want to say that. I can't even say it's not the first time. It is that way for some people.
Right.
But
I know, because I used to teach smoking cessation, and we would talk about, it takes at least 10 times to quit. It's very hard to break a habit, especially one that, sends off dopamine in your head and all those other things, and there are other pleasures people are getting, or they think they're getting, from substances. And so do we, it definitely takes some patience and some, staying the course, and they may have that relapse, but you're checking on them, making sure they continue their treatment. So, well, that's well, thank you, I guess, for all the work you're doing, because
thank you.
It's a tough business to be in. It can be. So referring to the Doorway seems very easy. You can walk in, you can call 211, they can call the hospital, the main line, and be connected to you as well. What have you seen any difference between, you know, the last few years and, you know, and substance misuse? We had a small decrease in overdoses during COVID. Have we seen anything change now that things are opening up, or?
In general, I'd say the overdose rates fluctuate. There was a reduction, but then they spiked again. However, this last month we had a pretty significant, it was 63% less AMR. The ambulance service, you know, provides data on that. So that's really great news. It also kind of varies with what substances are out there, what's being mixed in with things. So
right. Yeah. So things are so you brought some graphs, which we're going to pop up there, because as much as you do at the Doorway, you're also doing a little bit of work with alcohol. And again, we had said at the top of the program, it is Alcohol Awareness Month, so we don't want to forget to talk about that. You have a graph with Doorway, the new patients by substance used, and the dark blue
at the top there are folks who presented seeking treatment or seeking services with alcohol use disorder. Which, you know, looking at this, thinking, you know, yes, we're funded for specific, you know, for the opiates and the methamphetamines, but we are seeing, you know, up to a quarter of people who are coming in for alcohol use.
Which is a lot. And also I think, you know, when we think about, I don't want to say people have forgotten about it, but I do think in a way that it's been shoved out of the limelight. And I think that alcohol is one of the more dangerous silent killers among us. And I do have my cheating slide. So let's introduce it this way, that it's the #1 public health problem right now in the U.S., and that greater than 65 million people, these are my little factoids, report binge drinking in a 1 month period. That's a lot of people.
Yes, it is.
And then in 2019, so people understand, like, this is still a huge issue, alcohol was involved with 28% of all the traffic fatalities on the road. And then teen alcohol use kills 4,300 people per year. Probably a lot of those in those fatalities. So we don't want to forget about it. We want to bring it back out. We want to understand that it's just as important. When you're dealing with substance misuse, you deal a lot, you know, the Doorway primarily funded for opioids, but you do have this other grant, which brought me to you, which is specifically for alcohol related issues. Do you want to just describe what that involves?
Yes. So this is actually the third grant that we've received, all from our state government. And this is through Foundation for Healthy Families. So this last one is given to us to help support people who, with alcohol use disorder, who can't access treatment otherwise. So detox assists with like recovery housing, transportation needs, that type of thing. There is really a limited amount of resources for alcohol detox in the state. You mentioned one of the most dangerous, for all the statistics you mentioned. Alcohol is, if not the most dangerous, one of the most dangerous substances in terms of just death from use, whether it's the health effects of it, withdrawal from it is deadly, or can be deadly.
Yeah, and that's the thing, like, so if you're trying to withdraw and you can't do that by yourself, you can't just like quit cold turkey. It's not like a cigarette where you just, like, you'll feel awful and you might, you know, but the whole quitting cold turkey can be very dangerous. You know, I've did some reading on that as well, and, you know, you need assistance oftentimes when you're using that much alcohol. there were some tips online again about alcohol and alcohol use and how to even recognize that you have a problem or someone you live with has a problem. Any ideas on that? Any tips for our audience?
I'm curious what you came up with, but I mean, certainly, and again, I would say it's very individualized. I know some of the tips I've seen online too may not actually be something to look at.
Okay.
But that being said, most of them are. And I
Yeah.
think in general, you know your loved one well enough to know that there's probably something going on.
You know, if you're missing work, for example.
Exactly.
If you're missing work or you're chronically late to work or your performance is failing.
You're tired and irritable.
Right. If you don't have that drink or, you know, is it causing, mayhem in your household?
Yep.
You know, because, you know, kids are witnessing that. Maybe you have a family and, you know. So I think those are things that people have to pay attention to.
Yeah. Or if you know that your loved one said they wanted to stop drinking and you notice they did try, but you see like they're starting to be shaky and sweaty, and I mean those are physical signs.
Right.
And that's when it gets dangerous.
Yeah, so that's that withdrawal piece. So I found, so I said, try to go dry is a little self-test. I don't know, it said, just try to have an alcohol-free, if you suspect something is going on. So if you can pick a weekend during the month and abstain from alcohol, and then kind of look at what did that feel like. So like you just said, it says if your body has become used to that, continually having the alcohol and suddenly stopping can cause those physical effects, sweating, nausea, trouble sleeping, headaches. And then, so how was that weekend? And if it was difficult to manage those 72 hours from like a Friday to a Sunday without that drinking, you could signal that you might have some issues. So we just want people to take stock. Like, do you have to have it when you go out? Do you have to have it at night? You know, there's a rise in alcoholism among, or alcohol use, I should say, among women. And I don't know if that's something that you've seen in your practice as well.
Yeah, I don't know that I could say like statistically or kind of never really thought of it that way, but I definitely have read the research on that as well.
Yeah, that's just for whatever reason.
COVID certainly, I think, again, I can't really speak to numbers per se, but I can tell you like individuals who have come through said, I wasn't drinking, and then I started when COVID started because I was isolated and I was stressed and I lost my job and I had the time. Or people who were drinking, but they increased their drinking, certainly as a result of COVID. So I know that was a big impact.
Right, and you don't have as many eyes on you if you don't have to be to your office on time because you're working remotely or whatever the case may be. You're not driving as much. It might be a moment now that we're opening up again. Really got to keep our eyes on that. There's something called polysubstance misuse. So what happens when somebody comes to you where they have maybe an opioid addiction and an alcohol addiction? How do you parse that out? I know that's like a
yeah.
If you have the magic answer, we'd all love to know.
I wish I had the magic answer. No, honestly, that is so much more common, I think, than people think, right? Like, I have these slides, they present with alcohol use disorder. Really, it's probably polysubstance use. Very often, high percentage of folks are using more than one type of substance. What we have to do is look at what is the most dangerous to them in that moment and what needs to be taken care of first. And honestly, with alcohol use disorder, that's usually the primary one because of the dangers associated with it.
Interesting.
So yeah, it's complex.
Yeah,
right? It's complex.
It is very complex.
Everyone's
That's why I'm wondering, how do you
but
parse that out if somebody comes and, they have the substance misuse, the opioid misuse, and the alcohol misuse, and then which one do you kind of work on first, or is there a program where you can do both at once? Or
you can, yes. Most treatment programs, they
address all of it.
Because it's so common. Absolutely.
Wow. So there's a lot of work to be done out there, but we really appreciate what you're doing to get people into treatment and to the appropriate referrals. Are there any other resources in the community you just want to tell us about?
So certainly there's, AA, Alcoholics Anonymous, Narcotics Anonymous, Al-Anon for family members who experience someone in their family who's suffering or struggling with alcohol use. The recovery organization, so Revive Recovery, you can just walk in and get support right then.
Okay.
Those are kind of the big ones.
Okay.
But certainly, come into the doorway and we can talk, more detail about what maybe your specific needs are.
Right.
Any hospital system, you can connect with them. There's so many new treatment programs now out there as well.
So there are a lot of resources.
There
so
are a
we just want to
lot more
encourage
resources than there was.
So we just want to encourage folks to if they know someone that's suffering with addiction or misuse. I know I use the language wrong and I get corrected in my office all the time. Alcohol misuse or substance misuse. Please use the doorway. You don't want to be bored. I'm sure you're never bored because, people have to find you. But, again, use these services, come get that referral. It's a great place to start.
It is, absolutely. And really help is just a phone call away. Even if you just want to call and say, how do I talk to my loved one?
So you don't have to have the problem yourself. It could be for somebody else as well. So that's great. So please call the doorway, call 211. They can put you in touch with them. Call the hospitals, as we said before. And thank you, Kristin, for joining me and for letting us know about all the services. And I want to thank all of you. And just a reminder that we also have a clinic at Public Health. We offer immunizations on Tuesdays, Wednesdays, and Fridays. That's all your childhood immunizations and some adult shingles as well. And, of course, the COVID vaccine. We also have STD testing on Wednesdays and Thursdays. And we have lead testing Tuesdays, Wednesdays, and Fridays. So pick up that phone, 589-4500, press option 2, and someone will be there to assist you. And thank you all for joining us on Public Health Matters. Have a great week.